Today, we want to consider the importance of taking water as hypertensive patients. I will be your host, pharmacist Akanimo Odoigbo. It is common news that one of the causes of high blood pressure is increased level of urea and electrolytes. As hypertensive patients, there is need for you to have a reduced level of sodium ions in your body. That will automatically bring down the level of your blood pressure. And one of the ways to lose electrolytes in the body is through frequent urination. So you see, when you increase the level of water you take on a daily basis, you are already increasing the level of your urination. And by you having frequent urination, you are reducing the level of sodium ions in your body. And automatically, you are reducing your blood pressure. Again, if you have been placed on a diuretics that will cause frequent urination, causing you to lose a whole lot of fluid, you will be dehydrated at that point, and there is absolute need to replace the lost fluid that is already being caused by the medication you are taking. All you need to do is increase the level of water you take. When you increase the level of water you take on a daily basis, it will help you to have frequent urination, which will result in decrease in sodium ion level. And like I said earlier, it will equally help to replace the lost fluid caused by the medication administered to you earlier before now.
Continue.
Hi, have you wondered the role of exercise in hypertension? Exercise strengthens the heart. Regular exercise, such as jogging, dancing, cycling, strengthen the heart, making it more efficient, and as a result, allowing it to pump more blood with less effort. Exercise also improves blood vessels functions, thereby making them to be more flexible and less stiff. As a result, reduces blood flow resistance and lower blood pressure.
Continue.
Hello, still on the role of exercise in hypertension. Exercise help in weight management. Exercise will help in burning calories. By burning calories, it helps to maintain a healthy heart, which in turn help in reduction of high blood pressure. Exercise equally help to reduce stress, which is a significant factor in hypertension. Exercise also reduces the risk of cardiovascular diseases, such as stroke, which is often associated with hypertension.
Continue.
In our previous class, I made mention of weight loss as one of the lifestyle modifications for hypertension. And if you can remember very well, I talked about BMI, body mass index, that when it is greater than 25, you are already turning overweight. Today, I want to narrow down to what we call BMI. What is BMI? It is the measurement of the body fat based on the height and weight of an individual. How do you calculate BMI? When you check your weight and then you check your height, you multiply your height by 2. Whatever figure you have, you divide your weight by that height. The answer you get will be your BMI. For instance, if your weight is 65 kg and your height is 1.5 meter, by the time you multiply 1.5 times 1.5, you should be having 2.25 meters squared. And then you now divide 65 kilogram by 2.25 meters squared. You should be having about 28.8 kilogram per meter squared. So your BMI is already 28.8, which is overweight.
Continue.
How body mass index BMI is categorized. If an individual weighs less than 18.5 kilogram per meter squared, that individual is said to be underweight. If the person weighs from 18.5 to 24.9 kilogram per meter squared, the individual is said to have a healthy weight. And then if the individual weighs from 25 to 29.9 kilogram per meter squared, the individual is said to be overweight. And of course, if that person weighs from 30 kilogram per meter squared and above, the individual is said to be